Welcome to Voices of Care, the podcast series from Newcross Healthcare that seeks to get to the heart of the issues facing the health and social care sector by speaking to leaders about how we can enable the healthcare workforce of the future. I'm Suhail Mirza. Social care is one of the most important segments of our economy, employing over 1.6 million people. However, its workforce and the sector itself has been described as in a profound crisis. It's therefore really important to understand the drivers affecting the social care workforce, and there's no one better qualified than my guest today to explain that, Oonagh Smyth, the CEO of Skills for Care. Thank you so much for joining us. It's a privilege to have you here, and thank you for your time.
Thank you for inviting me.
Oonagh, as you're aware, many commentators, while lauding the importance of social care and its contribution, are highlighting the fact that it's in a profound crisis. The report that you produced last year highlights 165,000 vacancies and a shrinking workforce. Would you describe social care and its workforce as in a period of crisis or profound challenge?
So we know that social care is a fundamental part of our community infrastructure, and it's a fundamental part of all of our lives. And I think up until now that hasn't really been appreciated or understood. It supports people every single day to live the lives that they choose. We have a massive opportunity, I think, to position social care in the way that it needs to be positioned. But at the minute, looking at workforce, we don't have enough people working in social care today. So 165,000 vacancies every day. Our report talked about up until March last year. We're going to need significantly more in the future. And we've got a turnover rate that's much too high. And so if we really want to make sure that social care is in the best place that it possibly can be for all of our benefits, then we need to be making sure that we have the workforce in the numbers that we need with the skills and values and behaviours that we need. And that has to be the focus, or people who draw on care and support just will not be able to live the lives that they choose.
And the turnover rate's interesting. The report talked around the starter rate falling, the rate in terms of turnover around at 29%. I know there's not a single factor, pay, terms and conditions, training. Can you sort of reveal a little bit more about what the report highlighted in terms of these various factors that affect this workforce, shrinkage and the high turnover?
So our report gathers data from about 650,000 individuals working in social care, so about half of the workforce. And we've been gathering that information for the last decade. And so that allows us to see the trends in things like turnover and vacancy rates. And we've had incredibly high turnover in social care for many, many years. But we know that while about 29% of people will leave in a year, 2/3 of those are moving around the sector. So they still remain in social care. And that's really important for us to know and think about, because while they still remain in social care, there's a cost associated with that. But for the first time since we've been gathering that information, we saw the workforce shrink last year. So while demand is growing, we're going to need more people. We actually had a 3% reduction in the total number of people working in social care. And that would be a worrying trend if we saw that continue. We also saw a similar level of turnover, but a much lower level of new starters. So a 7% reduction in new people starting. And that gives us a sense then, if we really want to focus on this in the future, where we need to be putting our attention. So we need to make sure that we've got enough people starting in social care. But I always call it the leaky bucket effect. There's no point in doing that if we continue to lose the number of people that we lose. And we know from our data and from our predictive analysis what are the key things that we need to do to keep people. And I can talk about that at some stage if that's helpful. We have a really good sense of what we need to do. And so we need to focus on both of those areas, getting new people in and keeping them.
Just turning the dial a little bit in looking at an international perspective. I know that you've attended a number of conferences internationally looking at this phenomena, and recruitment and retention in social care is not a challenge which is unique to the British economy. It's a global issue.
Yeah, if you look across all of the OECD countries, every single country is having this conversation. How do we get more people working in social care? How do we keep them? How do we think about new roles that are needed? How do we work across health and social care? Other countries have been trying different things over the last number of years, and they're starting to show success. So countries like Norway, Japan, Denmark are trying some really interesting things, and we are seeing some of the statistics then shift for them. But everybody, or many countries, are dealing with the fact that we're going to need more people working in social care because people are living longer but not necessarily living healthier. So we're certainly not unique in that.
Now, as you said, it's a number of factors. I'm going to just briefly talk about pay, because obviously the report highlighted a reduction in real terms, 1.5%, in contradistinction to increases in real terms for the previous decade. So that remains a big lever in terms of the broader need for the sector to be properly funded.
It's an issue about base pay, absolutely. There's also a real issue with differentials. So if you work in social care for over 5 years, you might work in social care for 25 years, and you will be paid on average 7 pence more than somebody who's walked into a role that day. And so we really have to think about how we're rewarding people as they gather and develop their experience. We know that pay has an impact on turnover, and we know that it'll have an impact in terms of who comes into social care. The biggest factor influencing whether people come into social care or not is the local labour market. And so the more and more that we can do to break the sensitivities between social care and the local labour market, the better. That might mean pay, often means pay. It often means focusing on the terms and conditions. What are the things that social care can do that other sectors can't? That's flexibility we can offer, but also the real value of the role. So even though social care is very low paid, people stay in social care longer than they stay in other low paid roles. And why is that? Well, it's because they find the role really satisfying. And so there are things that we can do to differentiate ourselves from other sectors. But in the long term, in terms of when we think about our workforce strategy, we have to look at value and we have to look at pay.
And that bigger picture, if we can now just turn to the social care sector from a wider lens, it employs over 1.6 million people, plays a huge part, massive contribution to the economy. It's now in the press, but it's long been associated with what people perceive to be low value, low skilled, and yet we're moving into an environment where more complex care is delivered within the social care context. Can you give us a bit of a big picture in terms of this contribution social care makes and the workforce makes to the wider economy and indeed society?
So social care adds about 51 billion to the English economy every year. And that's not the narrative that we hear. We hear that social care is a net drain on society and a net drain on the economy. And that's certainly not the case. And the reason that becomes even more important is that social care isn't focused on one particular region of England. It is in every single street and every single community. And so it's adding to the economy in every single street and every single community. And that's incredibly important as we think both about the economic impact, but also the community impact. Because we know, if you look at the states, they're talking about social care as part of community infrastructure. And that's how we need to be talking and thinking about social care. We also need to talk more about the strengths of social care. Sometimes we can hear in the press, particularly, a narrative that social care, this bed blocking, and that social care is only seen as successful through the lens of health. And actually, social care is a lot to teach as well as a lot to learn. And we need to talk much more about what does social care do in terms of people's lives, in terms of prevention, personalisation, and what can we support other sectors to think about that we do really, really well. And these are highly skilled roles. Social care staff are doing things that district nurses used to do 10 years ago. And that's because people's lives and people's needs are getting much more complex, and we have much higher expectations of our social care staff than people value or recognise.
And I think the picture you've painted there is one of transformation in terms of the clinical delivery of services. And it's fundamentally about giving social care the parity of esteem with the NHS, because we often hear the narrative, well, actually, without social care, the NHS can't function, but we need to look at social care alone. Are we seeing that advocacy? Are you beginning to see that? I know that you, of course, have your own vision for a just and fair society. Are we seeing some indication from the government and policymakers that is beginning to recognise that? We've had a white paper, of course, not that long ago.
I think we are seeing, coming out of the pandemic, much more of an appreciation of what social care is, what its role is, what it can do. I think we need much more of that. I think social care needs to be seen as not just an escape valve or for the NHS. It needs to be seen in terms of the strengths that it offers and what it does, and what value we add. And I don't think we're there yet. I still don't think the public really understand what we mean when we talk about social care. I certainly don't think they understand fully the support that social care provides to working age adults. I think providing support to older people is probably better understood. People with a learning disability, young adults with physical disabilities or mental health issues, I don't think social care is really understood in terms of the breadth and the diversity of things that it does. And I don't think it's valued in the same way in the public consciousness. And that then trickles down in terms of our young people, where they think that they want to work. I spoke to somebody quite recently who was saying, don't you think that in social care, the public do understand and value social care much more than they used to? And my question back was, are you talking to your grandchildren about coming to work in social care? And she said, no, I'm talking to them about working in health. And so there's still that mismatch, I think. And social care has a bigger workforce than the NHS. And the opportunities that exist in social care are broad. And I don't think that's fully understood.
No, absolutely, and quite a lot of work to do there. I want to broaden the discussion to one of your strategic objectives, is supporting the capacity and capability of the social care workforce. Newcross Healthcare has its own mission as a learning partner for life to provide free training and education for anyone who enters social care and health. And I think the stats are clear from the report, your report, that those employers that place learning and development high on the agenda will have better outcomes in terms of lower turnover, for example. Can we sort of expand upon how important learning and development is presently, and also with the idea that there's going to be newer roles, of course, for social care to fulfil?
So we know that learning and development is important in and of itself, so that we have staff with the right skills and the right knowledge and the confidence. But we also know that it has a huge impact on whether people stay in an organisation. So if you train somebody, they stay. The more you train them, the more likely they are to stay. So if somebody has one incidence of training, they have reduced turnover. If they have more than 30 incidents, there's 10% lower turnover. And so that really gives us a sense of where it is that we need to be focusing on when we're thinking about retention particularly. As part of the white paper, the government has committed to supporting what they're calling targeted upskilling, which is both looking at the knowledge and skills and competencies that are needed in social care, trying to make that much clearer, trying to make career pathways much clearer, and investing money in learning and development as part of that competency framework. And that's going to be a really important part of the infrastructure that we need for the future. And a lot of other countries, particularly OECD countries, already have that in place, a really clear career pathway and development and investment in that development. And that really has to be part of the future, because skills are changing, roles are changing, the complexity, the interaction between health and social care is changing, but also our expectations as citizens are changing, and our expectations on social care are changing, and we've got to be ready and agile enough to be building those skills that we need for the future.
Absolutely, and you've produced a document relatively recently in conjunction with Health Education England about the importance of workforce collaboration, and part of that will of course be digital enablement for the workforce.
Yes, absolutely. We know that there's a huge amount of reform in the digital space, digital care pathways, and a real desire to digitise more of social care. But we also know that social care is so relational and so people-based. And so we need to make sure that the people that are working in social care have the skills, but also really importantly, the confidence to be able to use those tools. You know, we've all been through digital projects that have the absolute best of technology and the best tools, but the workforce don't feel confident enough to use them. And so we're doing a lot of work with the Department for Health and Social Care, Digital Social Care, other partners, looking at how we are supporting the digitisation of social care through the workforce, how we're supporting skills, how we're championing the social care digital development, but also really importantly, how we're building digital leaders in social care, because making decisions around where to invest in digital and having that confidence can be quite intimidating if you haven't done it before. And so I think that's going to have to be a continued area of focus if we're hoping to move to a different place in terms of our digital enablement.
That's a vision for the future. Staying in the present at the moment, the LGA and the Association of Directors of Adult Social Services and Skills for Care, at the time of the white paper, shared a vision about what social care workforce should look like. It talked about the importance of well-being and diversity. Now, I know this is a strategic objective that you have. Social care workforce, I think, is 82% female. There's almost a quarter, 23% from BAME background. So just touching on both those aspects, well-being and diversity, they are fundamental to allowing the current workforce to flourish.
Absolutely. And it's one of our strategic priorities, as you say, is culture and well-being and inclusion. And that came from the consultation that we did as part of our strategy. It came back so clearly. It's also represented in our data that one of the biggest indicators in terms of whether people come into the workforce and whether they stay isn't what the organisation is, it's what it does and how it does it. So that's about culture, it's about autonomy of decision making, it's about valuing people, it's often about saying thank you. And so thinking about what an organisation can do to make sure that people are really feeling valued and developed is incredibly important. And then if we look at the demographics in social care, 82% of the workforce are female, as you say. If we really want to be increasing capacity in social care, we have limited options. We can keep attracting the same demographic as we have now, and that's wonderful, but we don't have enough of them. So that's often older women, people with caring responsibilities previously, people with a health and social care qualification. We can try to attract new demographics, like men, or younger people who we can attract but we don't often keep. We can recruit from abroad, or we can radically change terms and conditions. And the reality is we're going to have to probably do a combination of some of those. But thinking about the makeup of roles in social care, who we're getting into those roles and how we increase capacity is going to be even more important in the future. And there's some really interesting things happening internationally in terms of that, particularly in Norway, where they've got a programme specifically focused on recruiting more men. And then when we look at the ethnic diversity of our workforce, we've got a really diverse workforce, so almost a quarter from Black, Asian or minority ethnic backgrounds, but that doesn't translate into leadership roles. And so we are doing quite a lot of work in that space. So support our Moving Up programme supports minority ethnic members of the workforce who want to progress, and it's quite an intense development programme. But we've also just finished the pilot on the workforce race equality standards in social care with 18 local authorities, and you probably know that's the res is available in health and gives really rich data to help trusts think about where they need to improve, and we need something similar in social care, because part of the issue is we don't have visibility of the experience of our diverse workforce, and in order to be able to make sure that people are welcome, they're getting the promotion, they're getting the development that they want, we need that transparency of data.
And that, I guess, also allows you to understand the lived experience of the people receiving social care, and also to draw on all the varied elements of our society and the background to attract them to the very sector that we're promoting.
Well, my dream is that social care is known as the most inclusive place to work and sector to work in, and the absolute best place to work. And I think we have that in us. We already have an extremely diverse sector, and I think the next focus has to be on the experience of people working in social care, and then we need to have that as a badge. We are the most inclusive place to work. Come and work for us, and I just think that could be so powerful.
It's a breathtaking vision, and I guess part of that now and in the future is the ground upon which this is going to bear fruit. In other words, the importance of a compassionate culture and compassionate leadership. I know that's something that you're very passionate about in terms of discussing and promoting.
Yes, absolutely. One of our partners or subsidiaries is Afina Organisational Development, and they work quite closely with, and we work quite closely with Michael West, who has written a fantastic book on compassionate leadership, and he works in health and social care, and all of the evidence and all of the research suggests that compassionate leadership is how we keep and develop people, how we make sure that we're delivering really good services and really good support. And we are doing an internal programme at the minute on compassionate leadership within Skills for Care for all of our managers, and we offer that programme externally as well. And it's often seen as a bit fluffy. It's compassionate, or it's everybody being nice to each other. It's a really, really brave way to lead. It means having honest conversations, having them early. It means really trying to empathise, but also, and this is a bit that I don't think we're always good at in social care, it's thinking about self-compassion and thinking about yourself. And we know that leadership in social care, particularly with our registered managers, that is the key to whether we provide really good services, to whether people come into social care and whether they stay. And our managers are often tell us that they are so busy that they don't get to focus on self-compassion and focus on themselves. And I think we've got to talk more about how we support managers to do that.
I think Professor West's work has been seminal for the whole of the sector, as you say. And I guess it also allows that sense of compassion for self, but also allows us to see the world through the eyes of the people who are living that every day. So it's a wonderful vision. I want to finally wrap up by looking at a bigger picture into the future. We have a workforce in social care, I think, according to report, average age of around 45. Nearly 3 in 10, 28% are aged 55 or over. And all the stats are showing that we're going to need 480,000 more workers in social care in about the next 10 years or so, 2035. We're going to lose quite a few people, likely, because of the ageing population of the workforce. How important is it going to be to really advocate and move forward in terms of promoting the sector in having enough people coming to work for us? And the importance of workforce planning and strategy. We've heard a lot about that for the NHS, less for social care.
Yeah, so we're expecting the NHS workforce strategy in the next few weeks. We've been told that's going to come in the springtime. We need the same for social care. We need a social care workforce strategy which sets out the choices that we're going to make, because we do have choices, even the 4 choices around how we get more people in. And so it's really important that we have those that national conversation, those national choices that are made, and that is then translated into workforce planning, regular workforce planning. We know that at a system level, the ICBs are responsible for workforce planning across health and social care. And so that will be really helpful to see that at a system level. But whereas in health, they're going to have those national priorities coming from the NHS workforce plan, they won't have the equivalent from social care. And I think that's going to be even more important. We don't have enough people now. We're going to need even more people in the future. And we're going to need different skills. And we've got to make sure that we are thinking about the workforce we need in 10 years' time, 15 years' time, or we will find that we just don't have enough people, or we don't have enough skills, and that will impact on people's lives.
And in terms of the advocacy for a workforce strategy, are you seeing that progress, the very idea that it's so needed in social care?
I think we've seen with the white paper, People at the Heart of Care, the first steps of that, which is choosing to focus on investing in the professionalisation and development and learning and development of the workforce, and putting in place some of that infrastructure. So I think that's a really helpful first step.
And in terms of the idea that we will see proper funding, a proper environment, I want to touch finally on the vision and hope, I guess, of integrated care systems. They do offer a system-level approach to workforce, cutting across boundaries, health and social care. Are you beginning to see the nascent collaboration across those silos? Because they have been silos for so long.
I think, like everything in social care, I'm going to say it's variable. I think in some cases we're seeing really good conversations. We can only legislate for so much. This is about relationships, it's about trust. And where those relationships existed previously, we're definitely starting to see those bear fruit. But it's not consistent across all ICSs. And in some ways, given the context in terms of health, that's understandable. I do think that the more conversations that we have across those systems, the more that understanding builds and the more the potential builds. We're involved in about 75% of ICSs at the people board level, supporting on workforce and workforce strategy. And I think it's quite early days, but I'm really hopeful, and we definitely are seeing some of those green shoots in some systems.
Well, on that hopeful note, I'd like to thank you, Oonagh Smyth, for your time and for your wisdom.
Thank you.
If you've enjoyed this episode of Voices of Care, please like, follow, or subscribe wherever you receive your podcasts. And if you want to find out more about what we are doing to enable the healthcare workforce of the future, please visit newcrosshealthcare.com/voices of care. In the meantime, I'm Suhail Mirza. Thank you and goodbye.